Hello, everybody, and welcome. Today, we are talking about science based methods for managing endometriosis pain. Endometriosis is a chronic, painful condition affecting roughly 10% of reproductive age women and girls around the world, which equates to about 190 million people. And in addition to being a painful condition, it can also make it harder to get pregnant. So it's a really important discussion for us to be having as a society. And we would really like to empower all of you today who are watching this to be able to walk away from today's workshop with tangible, concrete, real tools that you can use to manage endometriosis pain. Today, we are joined by a couple of amazing guests that I'm really excited to introduce. First and foremost, we have Gigi Robinson, who is a Gen Z digital creator, speaker, and chronic illness advocate who helps people build authentic personal brands through storytelling and social media. She combines her lived experience with EDS and endometriosis with industry expertise to empower others to share their stories, grow their platforms, and create impact online. And we are also joined by Dr. David Spiegel. He is the Wilson Professor and Associate Chair of Psychiatry at Stanford School of Medicine, who stands on a lifetime of clinical and research experience in chronic pain management. He is a leading world expert on pain, and he's helped thousands of people like Gigi in managing their chronic pain conditions, in many instances without medication. And that's actually what we're focusing on today is non-pharmacological science-based methods for chronic pain management. So we have someone who's an expert in the clinical and research side of pain management, as well as someone who's an expert in the lived personal experience. So I'm really excited for this dynamic balance of this conversation we'll have today. And without further ado, I'll pass it over to you, Gigi, to talk a little bit more about yourself and your personal experience with endometriosis.
Hey, so my name is Gigi. Thank you so much for having me. It is not only an honor to be here, but it's a privilege to be talking with world renowned Dr. Spiegel. I feel very, very lucky that I have this incredible opportunity. So thank you for having me. For those of you that don't know, I've been dealing with chronic illness and chronic health issues since I was about 10 years old. My journey to really understanding what was causing my chronic pain and how to manage it has not been an easy experience. It's been a very long and winding road, trying pretty much anything under the sun. When I was about 10 or 11, I got diagnosed with hypermobile Ehlers-Danlos syndrome thanks to a fellow, I think, or a resident in the emergency room at the hospital for special surgery in New York City who told me to go see the pediatric orthopedic unit there. And one of their doctors, Dr. Doyle, ended up considering that, hey, I think you might have hypermobile EDS based on your symptoms, based on the fact that you bruise easily, are very flexible, are getting injured all the time. And so I spent a majority of my adolescence and early adulthood trying to manage Ehlers-Danlos syndrome. So that was one of many problems. And I've tried medication, I've tried acupuncture, I've tried cold plunges, saunas, I've tried really everything. And I do think that there's tremendous value in holistic medicine and non-pharmacological medication and treatments, as well as also pharmaceuticals if you need it. And it's also up to the patient to craft their decision making process and to craft their treatment plan with their doctor, which I think is something a lot of people overlook. And that's kind of where my journey about posting on social media comes into play, where I have been helping people learn how to advocate for themselves and have right conversations going into a doctor's appointment so that they can really approach their health from the lens that they want and not just what the practitioner is telling them. So for me, I usually always go in asking doctors, well, or what are the different things that we can try before going into surgery? Which, if you do follow me, you'll probably know it. Also, have been very publicly talking about my journey with endometriosis over the past 3 years. In 2022, I ended up getting surgery, and the doctors found endometriosis internally through that surgery. And that surgery was actually very life changing. And it has since allowed me to get off of the pharmaceutical medications that I was on, which I believe was Lyrica and some other medications as well. And since then, I've been focusing a lot more on acupuncture, breath work, mindfulness, and other techniques, which I just absolutely love. And I think regardless of where you are in your journey, you can use a little bit of breath work and mindfulness and help yourself heal. So that's been a little bit of my medical journey. And I'm so honored and lucky that this is my job, that I get to help other people by collaborating with incredible world renowned doctors like Dr. Spiegel.
I'm glad to meet you, Gigi. And I'm sorry you've been going through all this, but I think you are setting an example. And the story already illustrates that it's not either or, it's both and, that it's integrative medicine, not alternative medicine. And what you're doing is combining the best of surgical and medical care with the best in how you can help better manage your symptoms. And it isn't one or the other. And one thing that people think is either integrative methods like hypnosis for controlling pain are either, useless or dangerous, neither of which is true. Or that if you can improve your situation using a technique like self-hypnosis, it means the pain's all in your head. And the strain and pain lies mainly in the brain. The brain processes signals that come in, and you can learn to process those signals better and help yourself feel better. And that's what you're doing. That's what I hope to help you do a bit better today.
Wow. That's phenomenal. And I also love that you place the emphasis on the concept of it being in your head and being something that you can manage, because I do think there are a lot of murmurs, whether it's online or in the actual medical community, about patients that are in their head, especially when it's a disease that you can't see and you show up looking completely normal, but you're physically in so much pain. So I really appreciate that you have that lens. And again, I'm just so lucky that I get the opportunity to try your methods out today.
Terrific. Okay, well, let's see what we can do. What's your pain situation right now, Gigi?
So I actually have been dealing with a tremendous amount of lower back pain pretty much since the middle of January. I also recently got a breast reduction. So I'm not sure if that had anything to do with, people say maybe it recalibrated my back and I'm dealing with all these other issues, but my lower back near my SI joint has just been so painful for a period of time. I was not able to actually bend over. I was squatting down, kind of
Oh,
like
wow.
that, instead of
Yeah.
bending, because it just was so painful. And I did actually end up getting some anti-inflammatory medication and muscle relaxers, but I've been taking them very sparingly. When I feel better, I don't take it. And it's not a medication that they said you must take it nonstop. So
Right.
again, it's a perfect time for me. And occasionally I'll deal with symptoms with the endometriosis kind of like in my abdomen, over, I would say, like just like right under my belly button, I assume, where my right ovary might be. I'll get a lot of pain there. And in the past I've had cysts. So I'm not sure if there's another cyst, or it could be endometriosis that has grown back, or just, that time of the month and it's really hurting. So
Mhm.
yeah, that's kind of where we're at today.
Well, does this pain map to that time of the month or not? Is it there
For
all the
me,
time? Or?
so the way that I ultimately figured out that I had endometriosis was the pattern of the pain. So it was very cyclical. I'd get lower
Right.
back pain and abdominal pain pretty much 3 to 3.5 weeks out of the month. And the only time I would not have the pain was when I was ovulating right after my menstrual cycle, which
Mhm.
is pretty common for endometriosis.
Right.
And
Right.
right now, though, the lower back pain has been pretty off schedule. Like it's just been nonstop. And
Yeah.
so we're not exactly sure what's
Sure.
causing this right now.
Okay. But you haven't had prior independent back pain, independent of the endometriosis?
Independent of the endometriosis, I had a herniated disc a little over a
Oh,
year ago, and then I went to physical therapy for it. I also got a steroid injection for it, but also doing
okay.
things like sauna really, really helped.
Well, sorry to hear that. On a 0 to 10 scale, how would you rate your pain right now?
I think the pain is probably maybe at like a 6.
Okay. So it's serious. It's one
Yeah.
thing for your listeners to realize that people often do not tend to communicate accurately the intensity of their pain, not because they don't want to, but they think people don't want to hear it or something. But, just listening to you so far, if people didn't know what you were saying, you'd say, she looks fine. You look comfortable, and yet you're dealing with pain at a level of 6 out of 10. And that's something to remember, that people are often dealing with a whole lot more inside than they're necessarily communicating.
So, according to my knowledge and personal lived experience of endometriosis, my understanding is that it's a chronic inflammatory disease that creates uterine like tissue kind of floating around as if it's like an extra little thread floating around in your abdominal cavity. My understanding is that they found it on almost every major organ in the body. And I definitely have been a patient that has dealt with endometriosis being found on multiple organs within my body and not just in the reproductive areas. So I think that it's really important to recognize endometriosis because it is a chronic disease. And there's also other things, again, alternative integrative medication and medicine, like the way that we eat. At one point in time, I was eating actually on an Ayurvedic diet, and that was helping me tremendously. Cutting caffeine, I haven't had alcohol for years, but that's unrelated to the endometriosis. But doing anything I can to limit the amount of inflammation I cause my body has been a life changer for me. And I think the more I talk about reducing stress, the less inflammation and chronic stress I'll have in my body. So that's my understanding of
That's great.
endometriosis from a patient first perspective.
Sure. So basically, what happens with endometriosis is that the kind of tissue that is normally on the inside of your uterus that is involved when you ovulate, when you change the lining of your uterus during the menstrual cycle, manages to get outside the uterus. And so you have these little seeds of tissue throughout, usually your abdomen, so they can come to rest on the outside, for example, of your intestines. And during that, they're hormone sensitive, they can bleed and they can cause inflammation inside your abdomen on the outside of your intestines. And that inflammation can be painful and it can cause strictures that can cause things that limit motility of the intestines over time. So it can affect your gastrointestinal system, but it also can hurt because you're having this inflammation and bleeding where it shouldn't be. It's handled fine inside the uterus, but not outside. And so the symptoms vary depending on where those little bits of uterine tissue wind up. So it acts like tissue inside your uterus, but it's outside. That's the problem. And so it's understandable why the surgery would have helped you a good deal, but it can be a chronic and very uncomfortable problem. And there are factors that trigger not just the bleeding that can come with having the tissue outside where it's supposed to be in the uterus, but also inflammation can come from that. So it can irritate parts of your body that normally aren't exposed directly to uterine bleeding. Inflammation can be related to a lot of things, including stress. So stress hormones like cortisol can affect how much inflammation you have. And so the immune system is regulated by the brain. It is affected by your level of stress. And there can be times when inflammation can get worse. There'll be some that'll just be there because of where that tissue is. But the way your immune system reacts to the stimulation that comes, unfortunately, from having uterine tissue outside the uterus is something that can, on the one hand, create stress, and on the other hand, respond to stress-related immune reaction to hormones and blood that shouldn't be where it is. So it's no fun. I understand that. I'm sorry you've been dealing with it, but I'm glad you're doing better. So you're having pain now that may still be related to the endometriosis, but also possibly lower back pain. One problem with pain is it's a kind of cycle. You know, as human beings, we're pretty pathetic physical creatures. We're not that big. We're not that strong. We don't run that fast. And so one way we've evolved to survive is by being very sensitive to threat and to stressors of one kind or another. So there's survival value in taking body injury very seriously. At least there was thousands of years ago. And unfortunately, our brains sometimes are wired to treat all pain as if it were acute and life-threatening pain. So you get this strong emotional reaction, understandably, to having pain, despite the fact that you know what this is now, or we have at least two ideas about what it is now. And you know that there's not any immediate threat to you. It's just uncomfortable. So while the brain can respond to pain in a way that would trigger an emergency response, it doesn't have to. And so you can learn to modulate the way your brain processes pain signals. And, medications are one way to do it, but frankly, we overutilize pain medications and we use meds, many of which are addictive and therefore dangerous. And so there are good ways to try and help people better manage their pain. The pain is real, it's there, but you can teach your brain how to manage it better. That's the idea. And learning self-hypnosis is one way to do that.
It's really incredible. And I have no doubt that every single person listening has the power to use self hypnosis and mindfulness to harness this. I know when I was struggling at the very least, when I didn't know I had endometriosis and I thought
Mhm.
Ehlers syndrome. And for those that don't know, that's a connective hypermobile disease where your connective tissue is hypermobile. So the way I like to personally describe it, again, from a patient first perspective, is that if I had a rubber band for my hair, it stretches out, but it doesn't snap. And as a result, it makes my joints more prone to subluxing or dislocating or getting a fracture much easier. And growing up as an adolescent and a teenager, the solution was not actually medication for me, but avoiding contact sports and sitting out in gym class and taking the elevator or the escalator and doing physical therapy and swimming after school. And those are all things, I guess, at the time, if you're, in middle school and you can't play in class and everything. I mean, it's really everything is so connected to the mind and the body, because the second that you have to sit down in gym class or do physical therapy on the side in gym class instead of playing dodgeball, all of a sudden you're the weird kid sitting out on the side and you have all of this chronic pain, and then you're feeling bad about yourself, which may inherently make your pain feel worse. So it's this really unique cycle. And I think that this can continue through college. This can continue when you are working in, your adult life. This can continue in your relationships when somebody doesn't want to date somebody that's dealing with a health issue. As I know, as messed up as that sounds, that's a reality. I have friends that are facing that I previously had faced before my current relationship. And I really think, aside from endometriosis, this can help so many people. This can help any single person watching who struggles with pain in any way.
I appreciate what you're saying, and I admire the clarity with which you describe it and have dealt with it. And it's hard. It's true that particularly in those years, you don't want to be separated out as different and not able to participate in things that most people can. And everybody has some things they got to deal with in their life. You got your share, and you seem to be handling it very well. But let's see what we can do to help you be able to handle it even better and more comfortably.
Let's do it.
All right. So the first thing I usually do, seeing someone who wants to learn to use self-hypnosis, is assess how hypnotizable they are. People differ actually in their ability to experience hypnosis. On the one hand, most 8-year-olds are in trances most of the time. You see a little kid play, work and play are all the same thing. He doesn't hear you when you say, come in for dinner, he's just doing this thing. But as we go through adolescence and we learn to value logic and cognitive exploration more and experiential learning less, some people lose some of that ability to narrow the focus of attention. Gigi, did you ever have the experience in a good movie of getting so caught up in the movie you forget you're watching a movie and you enter the imagined world?
Maybe here and there, but I tend to stay very focused on the movie. So sometimes I'll think about, oh, what did that person mean by that? But then I'll go on because I find the movie really interesting.
Okay, good. Well, that sounds like someone who is moderately hypnotizable. People who are very, and I'm going to do a test and we'll find out. People who are very hypnotizable just get so lost in the movie that later on they may ask those kinds of questions, but during the
Okay.
experience they tend not to. On the other hand, there are some people that never let themselves get into it at all. That they're always sitting back and evaluating. And so what I'd like to do is give you a test called the Hypnotic Induction Profile. Takes about 5 minutes and we'll see how hypnotizable you are.
All right.
Okay.
I'm just going to take a sip of water before.
Fair enough. Are you right or left-handed?
I'm right-handed.
Right-handed. Okay. So can I ask you to put one arm on either arm of your chair there? Like
Just
that. Good. No, both arms. And I'm going to give you some instructions about your eyes and then your left-handed arm. Okay. So on one, please do one thing. Look up all the way up high as you can. Keep your chin down, keep your head
Chin
straight
down.
looking at the camera, but look up. That's it. Look up high as you can. And as you keep looking up, slowly close your eyes. Close. Good. Take a deep breath. Let the breath out. Let your eyes relax, but keep them closed and let your body float. Just imagine you're floating somewhere safe and comfortable, like a bath, a lake, a hot tub, or floating in space. And while you concentrate on your body floating, I'm going to concentrate on your left hand and arm. In a moment, I'm going to ask you to take your right hand and gently stroke the back of your left middle finger past your wrist and all the way up to your elbow. And go ahead and do that now. And as you do that, you'll feel a sense of tingling and numbness and lightness in your left hand and arm, and let it float up in the air like a balloon. That's good. Just let your left hand float upwards as if you had tied a balloon to your wrist. Good. And I'm going to give you this instruction. Your left hand will remain light and in this upright position even after I give you the signal for your eyes to open. Later, when I ask you to pull your left hand back down to the arm of the chair and let go, it will float right back up to the upright position. You'll find something pleasant and amusing about this sensation. After that, when I ask you to touch your left elbow with your right hand, your usual sensation and control will return. Each time you go into this state of concentration, you'll find it easier and easier to do, and you can use it to help you concentrate on what's important to you. Right now, we'll come out of this state of concentration together by counting backwards from 3 to 1. On 3, get ready. 2, with your eyelids closed, roll up your eyes. 1, let your eyes open. Ready? 3, 2, 1. Good. Now stay in this position, please, and describe what physical sensations you're aware of now in your left hand and arm.
I think that I felt the initial tingling that you had mentioned I would feel when I used my right hand to go through my middle finger up to my elbow. And I feel actually mostly the muscle in my shoulder working to hold my hand up. But from my elbow to my hand, it's pretty, I wouldn't say numb, but it's pretty like normal, painless. Like, doesn't, I don't know if it feels connected.
So it feels as if it's not as much a part of your body as your right hand?
Yeah, I think so.
Okay. And do you have some tingling sensation in it or not?
Yeah, a little bit, maybe not tingling, but I just felt like a little bit of a shift, maybe. In a way, it feels kind of like when I get acupuncture and I'm really, really relaxed. That's what it kind of feels like in my left hand.
In your left hand. Okay, benign,
Yes.
right. All right. Now, please take your right hand, pull your left hand back down to the arm of the chair, and then let go.
Or not.
I'm sorry, what?
I wasn't sure if it should go back or
Yeah.
not, but I'm able to lift
What?
it down.
Well, turn your head, look at your left hand, and watch what's going to happen.
I think from my wrist, it's definitely wanting to come up, actually.
It is. Good. All right.
It is, yeah. It is wanting
Good.
to
All right.
come back up.
It was. All right. We'll just watch what happens and let it happen.
Yeah, you can even see it. You can see it
Yeah,
happen.
I can see it. Yeah. What does it
Yeah.
feel like?
What does it feel like? I don't know what it feels like. I've never really felt this, but yeah, I can see it moving, and it's
Good. All the way
definitely not me moving it,
up.
which I'm sure you love seeing.
I do.
Yeah, it's now floating above the
It's
chair.
floating.
Yep.
Great. And just continue to imagine as if it were a big buoyant balloon and let it float upwards. That's good. All the
Yeah.
way up.
It's definitely slowly coming up. Very interesting.
Did that surprise you at all?
Yeah, it does. It does, because I think when you live with chronic pain, you are constantly trying to control your body. And this is something
Mhm.
I can't control. I actually am not controlling this at all. My hand's in the air and I'm not controlling this. So yeah, that's pretty amazing To anyone watching, I swear this is completely out of my control. This is awesome. It's so cool. And you know what it looks like? It really looks like my hand is actually floating. It doesn't
Hmm.
like I'm not just holding my hand in the air. It's just that like it genuinely is floating. And almost actually now I have a new sensation. I can almost feel my pulse on this.
Hmm. Hmm.
I can
In your
feel my
left hand.
on my
Yeah.
left hand. Yep.
So you've changed your relationship to your left hand and arm. Yeah. That's
I
great.
definitely just did. Pretty incredible. And as you can
Very-
tell, it's coming up
Yeah.
slow.
Yeah. I've noticed. That's good for you. So you're changing the way your brain relates to your left hand and arm.
Wow.
Now, by way of comparison, Gigi, please raise your right hand. Put your right arm down. Are you aware of a difference in sensation and control in your left hand you have compared to your right?
Absolutely. Absolutely. Yes.
Over which hand do you have more control right now?
You're right.
Right. Okay, good.
Wow. This is incredible.
Cool. All right. Now, please take your right hand, touch your left elbow, and then let go.
Yeah. Wow.
What happened?
I think it brought it back down. Now I can have movement of my elbow. Whereas before it felt very, not robotic, but it just felt very, it was in its own, from my elbow down, it was in its own world. But now I feel like I can move my shoulder again, which is just
Yes.
that.
Cool. So it felt like it sort of had a mind of its own. Huh? It was doing what it
Wow.
wanted to do. Good.
Yeah. Well,
Um,
it was doing what you wanted it to do.
well, we wanted it.
That's true.
Okay. Did I do or say anything that would indicate there'd be a change in sensation or control in your left hand and arm?
You told me that I would see as I touched my arm, that I would feel possible a lightness and
Hmm.
maybe tingle as I was setting everything up. But other than that, I don't remember you saying anything other than that. No.
So why did you get the control back?
Why did I get the control back? Or when? Oh, well, you did tell me something about only when I touched my elbow that I
Uh,
get the control back. I
uh,
remember that now.
and do you remember now touching your elbow? Yeah.
Yes, I remember touching my elbow moments before.
Okay. And did you have a sense of floating lightness or buoyancy in your left hand and arm during the test?
I think so, yes. I
Did you
think
have that sense? Oh, go ahead. Yeah.
no, I think as it was rising even more, I was realizing not only that I, like, wasn't in control of it, but that, like, somehow it was rising and it wasn't heavy. Whereas, like, gravity on my hand, if I'm holding it up, I feel gravity pulling it down, but on this one, it didn't feel like.
Did you have any sense of floating lightness or buoyancy elsewhere in your body? Head, neck, thighs, abdomen, chest, all over, or just in your left hand and arm?
I don't think I was paying attention as closely to my whole
Yeah.
body,
Yeah.
but just in terms of my posture, I felt my shoulder muscle was like working, but not like working in the way that if you do a push up, it's working. I didn't
No.
feel it in a sense of like a pain or anything, a lot, but I felt like it was working. I don't know if that was my mind or what, but yeah, maybe I felt lightness, but I was very focused on my arm.
Okay, great. And how would you rate your pain right now on that 0 to 10 scale?
I'd say it's definitely down. Like for context, like the reason I'm tilting my head down is because whenever I tilt my head down, I feel it in my lower spine right now, but it's significantly less than it was. Like I don't think it's no longer at a 6.
Huh.
Maybe I'm more at a
Good.
3. And if that's the case, then I've halved my pain just by doing this short exercise. That's pretty incredible.
Terrific. I'm so glad to hear that. Not surprised. Well, you're very hypnotizable. Your score is 9 out of 10.
Oh,
We both know now you can do it. You've got the ability to do it. So,
fantastic.
and now we can push even further and see what we can do.
Oh, this is exciting.
So I want to teach you a way to go into a state of self-hypnosis.
Okay.
On one, you do one thing, just look up again as we did it together. Two, do two things slowly, close your eyes and take a deep breath. And three, do three things, breath out, eyes relax, body float. And then let one hand or the other float up in the air like a balloon. And that's your signal to yourself and to me that you're ready to concentrate. And you can let your arm rest if you want, your elbow rest on the arm of the chair, but let your hand remain upright. So bend your elbow. That's good. And you don't have to bend your wrist, but bend your forearm. That's it. And let your hand rest in a comfortable upright position. And please imagine that you're floating somewhere safe and comfortable, like a bath, a lake, a hot tub, or just floating in space. Taking a nice deep breath through your nose, starting with your abdomen. Hold. Now expand your chest all the way. And then slowly exhale through your mouth. Again, inhale through your nose, starting with your belly. Hold. Now fill your chest completely. Slow exhale through your mouth. One more time, inhale, starting with your belly. Fill your chest completely. And then nice, slow exhale through your mouth. And with your eyes closed and remaining in this state of concentration, please describe how your body's feeling right now.
I think that my body's feeling very peaceful, like I'm about to do a meditation, or I'm in shavasana on the floor, trying to just calm my nervous system down and stay present.
Good.
Little lightheaded, maybe, but there's probably reason for that.
Okay. Well, we're combining hypnosis with an exercise called cyclic sighing, where you inhale quickly through your nose and slowly exhale through your mouth. And it helps to relax your body and start with your body rather than your mind. Use your mind to soothe your body right now. So imagine somewhere where you naturally feel safe and comfortable. And if your discomfort is less, if you're taking a warm bath or if you're taking a cold water plunge, just imagine you're in one of those situations right now. And feel a sense of warm or cool tingling numbness. Let it filter the hurt out of the pain. How's your body feeling?
Definitely very relaxed. I have the feeling of a warm bath, but the views of Delray Beach, Florida.
Cool. So just imagine that sense of warm, tingling numbness penetrating deeper and deeper into your body, and enjoy the view. Each breath out, let a little more of the tension out of your body. Slow exhale through your mouth. And feel that pleasant sense of warm, tingling numbness in your body, as if you were in a warm bath. Enjoy the view. Notice how quickly and easily you can use your store of memories and your imagination to help yourself and your body feel better. How's it feeling right now?
Definitely, yeah. I think my arms, my legs, my abdominals are feeling very calm. I think I can actually feel my lower back. I don't know if it's releasing or activating, but I do think I'm intentionally placing focus there to try and release pain in my lower back.
Good. And what physical situation is associated with being able to release that pain? Are you, for example, do you often tense it up because you're afraid that it's going to cause you pain? Is there a way that you can imagine that the warmth is letting your muscles relax? Massage is helping you relax the tension in those muscles.
Yeah, I think what helps me relax is the thought of being relaxed and not stress. I think I'm the kind of person to tend and work and work and work and push myself mentally to achieve certain things. And by the
Mhm.
time I've achieved them, sometimes I'm reaching a place of burnout or, you know, just mental stress of having so many things and projects going on that I feel like I can't get everything done. And then I end up internalizing and making it feel like I haven't done enough. And I feel like physically that makes me more in pain. So I actually recently started doing daily warm bath at night at the end of my day
Good.
after work. I turn work off, and that actually has been tremendously helpful. But aside from that, yeah, meditating or looking out in the ocean or swimming in the ocean down in Florida around sunrise or sunset is like one of the most relaxing things
Right.
I've experienced. So,
So why don't you imagine right now, get your brain into that same state that it's in, either when you're taking your evening warm bath or swimming at sunset in the ocean, and just try and help yourself and your body inhabit that experience and let it filter the hurt out of the pain. And each time you exhale, just feel yourself letting go of some of that body tension associated with your many projects and focus instead on just soothing and relaxing your body. Each breath out, let a little more of the tension out of your body. Exhale through your mouth slowly. How's your body feeling now?
yeah, definitely a lot lighter. Less
Great. And how would you rate the level of discomfort right now?
like pretty minimal, like maybe even less than the exercise before.
Right. So notice how quickly and easily you can use your stored memories and your imagination to help yourself and your body feel better.
It's
I want
incredible.
you to think of your body as if it were your child. And when your body uh, is stressed or in a state of discomfort, do what you would do with a child. What would you do with a little child who was in pain?
Probably tell them to calm down as I
Mhm.
nurture and help.
Right. So use that natural reaction with your own body and notice how it responds when you set aside time for a warm bath, for taking a swim. Now you can let the tension out of your body and in the secure knowledge that you can help your body feel better, you can modulate it. It doesn't need to be a struggle between you and your body. It can be a collaboration where you act like a good mom to your own body and soothe and comfort it. How are you feeling now?
Oh, good. It's very, very calming. I feel like I need
Good.
this every Monday.
Well, anytime you need it, I'd make it a daily practice. Monday is a good day. You're heading into the week, but anytime you feel a sense of discomfort or stress increasing, just sit down or lie down, go into this state of self hypnosis, and reestablish your ability to help yourself and your body feel better. Just takes a few minutes and it can help you help your body. And take a few moments to reflect on what this means to you in a private sense, and then we'll come out of the state of self hypnosis by counting backwards from 3 to 1. 3, you'll get ready. 2, with your eyelids closed, roll up your eyes. 1, let your eyes open, your hand float back down, make a fist open, and that'll be the end of the exercise. 3, 2, 1.
That was lovely.
Oh, glad.
Lovely for sure. I think my immediate reaction is that aside from from loving breathwork and knowing that this kind of tool would be valuable for me, I think again, there's this really big, loud murmur or whisper in the chronic illness community that mindfulness, oh, doctors just telling you to go be mindful. But really finding those things that help you tune into your body or tune into your most calm self, your most some people need to do this before they go speak, right? For example, like I know Tony Robbins and his ways that he gets himself ready. He changes his state. He does it in a very bold way, but we're
Mhm.
really doing something very similar, just in a much more relaxed, self-soothing way to help us feel our best physically. Tony's, at least in my experience, has been very about our mental fitness, our mental ability to push ourselves physically and, defy the odds, whatever. And all of that is valuable. But I could see myself doing this before I go and speak to people or before I go and teach a class if I'm feeling nervous
Mhm.
at all. Because feeling nervous makes my body want to get
Right.
really, really tense. And so I feel like this would really, really help me across the board, even in confronting, an issue or with a family member or my boyfriend, or if my dogs are driving me absolutely bananas. I'm sure I could use this technique and I'll definitely continue to use this.
Absolutely. Well, I'm glad to hear that. And you do it very well anyway, but you speak very well. You're, clear and direct. But it's a matter of, in particular, interrupting that cycle I call the snowball effect, where you get a little nervous, your body reacts and gets tense. You notice
Yeah.
that you get more nervous and it builds on itself.
Right.
And instead, if you can just allow your body, make your first priority to get your body comfortable
Yeah.
the way you would soothe the baby, and then you can deal with the problem. So another thing we can use self-hypnosis for is just once you get your body comfortable the way you just did, you can picture on an imaginary screen one thing that's making you nervous or worried or whatever it is on one side, but keep your body floating. So I can understand that I'm worrying about something, but my body doesn't have to react to it. And then use the other side of the screen to picture one thing you could do to deal with that problem on the left.
Yeah.
So sometimes good speakers, will sort of picture the outline of what they want to cover so that while they're talking about any given part, they know where they're going. They've got the big picture and they communicate more clearly that way when they do it. So that's just one example. But if you start from the body up, you can often very quickly manage your anxiety as well as control your pain.
Yeah. I think another thing about what you're saying is like, if you prepare your body to react a certain way, then you're going to have more control, which is, I think, the ultimate thing humans like to want in this world and in this life is control over anything, our emotions, our thoughts, our mind. And really, our mind and our actions and our physical body is the only thing we can control. We can't control how the person driving a car or walking the street is going to walk in front of you, right? We can
Right.
only control how we react to things. So I really love this approach and that it's just a great reminder that really we do have control and you can get into self-hypnosis and you don't need to go to a fancy class or anything. You just need to have a session with the amazing Dr. Spiegel.
That's that's
And
very nice.
like,
Or you can download Reverie and you can
yeah.
hear my mellifluous voice anytime you want. And Reverie will take you through these exercises for controlling pain, controlling stress, getting to sleep. So I welcome people to download the Reverie app and give it a try and see if it will help you do what you just did.
Yeah. I mean, it's truly shocking when I tell you, like, this is the most I've been able to put my head down without pain since January. I'm
Love it.
really not even kidding you right now. Like, I don't have like any pain in my lower back where I did at the beginning of the session.
Love
So
it.
this works. You knew it worked.
Terrific.
You totally knew it worked. But I'm gonna to tell everyone that yes, this really does work, and I will definitely be incorporating Reverie into my daily and or if I am too busy, and I know we're never too busy, but I am too
Right.
busy, hopefully my weekly schedule.
That's great. Well, thank you. I'm delighted. I'm not surprised, but I'm pleased. I'm very glad that you're able to use it so well and articulate so clearly what you did. I think that will be very helpful to a lot of people because
I hope so.
you've demonstrated it, but you've laid it out very clearly.
Yeah.
So when people ask if people like me can get your back, the answer is yes.
Yes.
I've got your back,
Yeah.
and I hope you'll continue to use this skill. And it is a skill. You know, people are afraid of hypnosis. They think they're losing control. What I think and then tell me if I'm right about this, you feel you've gained control. You've enhanced a new way of controlling how your body works and how it feels.
As though I may not have control over the pain that I'm feeling, I have control over the thoughts that I'm having. And I know inherently, I know your research probably backs this up, but what we think
Mm,
affects how we act and affects how we live and react to the world around us. And so if I'm able
mm,
to control my thoughts, even if it's not just about having impulses, if it's just the thoughts that I'm having about my physical body or my surroundings, and I really am able to kind of like drop in and transport my mind somewhere else in order to prepare for something, in order to reset, in order to just simply take a moment for myself. I'm sure you can incorporate other things like gratitude and, I'm sure there's different levels that you bring patients through and that individuals can take. But I mean, for me, I've tried almost anything out there, anything and everything. And for me, this is just another tool in my toolbox that I can use to help me manage chronic pain. And I hope every
right.
single person listening feels that same way and is willing to have an open mind to try this too.
Well, that's great. But I just want to clarify something. I think you may have understated what you just did because you're not just reacting differently to the same level of pain. You've changed the level of pain. Is that right?
Yeah. Yes. Yes. You are right. Yes.
So it's a kind of feedback system where
Yeah.
the more you can change your strategy of reacting to it, the more you literally change how you feel. Yeah.
Yeah.
What's
Oh, yeah, I just wanted to reposition and see if it was the position that mattered or if it was the pain level, but I really do think it was the pain level, like you said, which is arguably so much cooler.
yeah, exactly. Exactly. You can literally change how much pain you feel. The strain and pain lies mainly in the brain, and you're using
Wow.
your brain to change it.
And so I have one more question for you. Is there a limit or a threshold to one, like how long the effects of the self-hypnosis can last? And two, are there limitations to how often you should be doing this? Like, if you like you drive too much on a tire over time, you're gonna need to replace the tire. So does this kind of work that way, or is this something different, kind of like a battery that just like recharges?
Yeah. Well, don't do it while you're driving, but
Oh, of course.
no, there's no limit. I mean, the nice thing is that after a while, it's like learning anything else. It's like learning a physical skill. It
Yeah.
begins to become second nature after a while if you keep doing it. It helps at first to be a little disciplined about it and do it regularly. You don't have to take that long, but do it so that after a while, you just naturally start to do it. So
Wow.
when you notice the pain is a little worse, just take a few minutes. It doesn't have to take long. Go into the state of
Yeah.
self-hypnosis, get the floating and warmth back, and go on about what you're doing. But after a while, people just kind of do it all naturally. But it doesn't have to be a big, long thing. You don't have to take a half an hour to do it. Just take a few minutes. Do it when you need it and anytime you need it.
That's incredible. I definitely am going to be changing some things about my schedule and just taking a few
Great.
minutes to
It's just a shift into a state of highly focused attention, like looking through a telephoto lens in a camera. What you see with great detail, but you're less aware of what's going on at the periphery. That's how you focus that much. What happens in your brain, what happened in your brain, Gigi, was you turned down activity in a part of the brain called the dorsal anterior cingulate cortex. There's a cortex that looks like a C on its ends, right in the middle of the brain. And the front part is part of our alarm system. It goes off, you hear a loud noise. That's your anterior cingulate saying, wait a minute, maybe this is trouble. Maybe I need to do something. When you're in hypnosis, you turn that down. So you're less likely to be distracted or interrupted in focusing on something else. The brain is not saying, hey, wait a minute, you're not on the beach in Florida. You're just imagining it. You just experience it as if you were there. You turn down that system. You increase your brain's ability to connect to the insula, which is an island of tissue in the middle of the front part of the brain that is a conduit for mind-body interaction. So your brain better controls your body, and your brain better understands, has interoception of what's going on in your body. And you also turn down activity in the back of the cingulate cortex, which is what we call the default mode network. It's a part of the brain where you evaluate when you're not doing anything else. You're thinking, who am I? What am I? Am I doing it right? Would my mother be proud? Or, whatever it is. I sometimes call it the my fault mode network. But you suspend activity there. So the fact that you've just been able to reduce your pain from a level of 6 out of 10 to one where you can move your neck the way you couldn't before is something that before this you might have thought, no, that's not possible. It couldn't happen. And you're able to suspend judgment and just explore and see what it's like. So it's a way of trying out being different, and it is accentuated, that ability, in hypnosis. So you're able to reduce your stress and anxiety, reduce your pain, and suspend your disbelief about whether that would even be possible.
Wow. So, what would you say? Because I'm sure you've worked with a lot of patients who deal with chronic health issues. I guess my one final question to you would be like, in this instance, like I know you mentioned it a couple of times, I've mentioned it. When you're able to control your pain level by using your mind, but maybe you do have a herniated disc, or maybe you do have a severe
Yeah.
endometriosis flare up, even though the amount of time that this relief can last may be limited. I guess my question would be like, how like some people may not want to try this because of actually the power that they'll have over their body. Maybe they don't want the power. Maybe they're afraid that it'll only work 70% of the time. So I guess my question would just be, what are your words of wisdom or your advice to a patient dealing with constant chronic pain and inflammation who may be hesitant, resistant, nervous to try this? I know you were talking about judgment before, but I would just love to know as a doctor, kind of like what, from your perspective, would your advice to a patient exploring this be?
Sure. Well, pain is certainly a useful signal. And, if you've just broken your ankle, you need to know about that and do something about it. But it's like somebody telling you something you don't want to hear. They don't have to yell at you. They can just say, hey, look, we got a
Mhm.
problem. And so you can instruct your brain just the way you did here to be attuned to any change in the signal, but it doesn't have to hurt like hell for you to pay attention to it. And in fact, the kind of problem you're talking about is more a problem with pain medication, actually, where you really are numbing the signals and you may not know that you've done something more that hurts. Whereas here, you, as part of your experience doing the self hypnosis, say, if this changes in some way, I want to feel it. I want to know what it's like. But you can turn down the volume, but adjust the volume so that if you need to hear it, you can hear it.
Wow. I love that analogy, and the way that you've described this is way less intimidating than the concept of, self hypnosis as a whole. So I really appreciate you taking it down to a patient level. So I appreciate it.
I'm so glad. Well, you're a terrific patient and you've done extremely well with it. And there is plenty of evidence in the scientific literature. There are meta-analyses. We published randomized trials showing that even in acute surgical situations that where you don't use general anesthesia, but the people who use hypnosis have far less pain. Like it's down the way yours did to 2 out of 10. Whereas in the standard care group where they're pushing the button and giving themselves opioids, they have 2.5 times more pain than the people in the hypnosis condition. And the hypnosis people in one of our studies were so relaxed, they had no anxiety at all. I was afraid they all died or something. They were fine. And the procedures got done 17 minutes quicker on average. So it's safer and fewer complications. So safer, quicker, faster, and less pain and anxiety. So you got a lot to gain and nothing to lose by giving it a try.
Yeah. And I would just echo every single thing from the patient perspective. This was such a cool opportunity to experience firsthand. Again, I'm looking forward to getting onto Reverie for every single one of my followers, my audience to try this, whether you're stressed at work, whether you deal with a chronic illness, or whether you have, anxiety and depression. Like, this is definitely something you should try. I had just such a great time. It was a total honor to be here today. And I think that this is just one of the coolest things. I already know and have loved breath work over the years, but to really combine this, I guess, this more in-depth approach with the self-hypnosis, with the breath work, and focusing so much on my physical body, like, it is shocking to me how much I was able to move my head up and down, where I mean, it was such a challenge earlier this month, earlier this year. So this is just, it's like blowing my mind a little. I'm a little bit shocked, but in the best way,
I
because
love it.
now,
I
again,
love it.
as I mentioned, it's just another tool in my toolkit, and I hope that every single person watching really gives it a shot.
I hope so. And I hope when you watch, you notice that she's shaking her head yes, up and down, not no. Yeah.
There's a reason.
You're feeling it. That's great. Well, thank you for being willing to explore this with us. That's terrific.
Anytime, if you give me a call and you say, Gigi, we want to do a live demonstration, can you be our star patient? I'll literally fly across the country and I'll be there.
Oh, you're great. Thank you. Thank you. I'm so glad. It's been a pleasure.